Hello, my name is Debbie Washington. The title of my speech is Delayed Umbilical Cord Clamping. The purpose of my speech today is to persuade you that delayed umbilical cord clamping should be practiced and offered by all capable hospitals. Why? Because your baby deserves a good start at delivery. Today I will be discussing three things. I will be discussing problems and the need for change pertaining to delayed cord clamping. I will be discussing a solution to the problem, and I will also be discussing the benefits of my proposed solution and also the benefits of delayed cord clamping. So first, let's discuss some problems and the need for change pertaining to delayed umbilical cord clamping. Everyone is not practicing delayed umbilical cord clamping. A change is needed. According to the American College of Obstetrics and Gynecology, only half of the United States hospitals report delayed cord clamping for most healthy newborns, with variations by hospital location and cesarean birth rate. A change is needed. World Nutrition Journal states that more than half the cases of anemia are due to iron deficiency. Anemia is a major and global public health problem that affects maternal and child mortality. It also affects child cognitive development and eventually productivity. Infancy, adolescence, and pregnancy are all at risk for anemia. And I wanted to repeat that. Infancy or infants, adolescents, and pregnant women are all at risk for anemia. A change is needed. The American Journal of Obstetrics and Gynecology Maternal Fetal Medicine states that anemia during pregnancy is one of the most common diagnoses among pregnant women, given that it is estimated to affect 40% of women worldwide. A change is needed. According to the American Journal of Gynecology, anemia is associated with preterm births. And I'll repeat that again. According to the American Journal of Gynecology, anemia is associated with preterm deliveries. A change is needed. Necrotizing enterocolitis is a devastating pediatric gastrointestinal disorder of preterm infants, according to the Journal of Infectious Disease. So anemia can be associated with preterm births, and a problem in preterm babies is necrotizing enterocolitis, which I told you is a devastating pediatric gastrointestinal disorder of preterm infants. Intraventricular hemorrhage, and a more common name for that is a brain bleed. Intraventricular hemorrhage is the leading cause of mortality and disability in premature neonates. A change is needed. So there are two things that you see I tell you that anemia can lead to preterm births, and two things that you see in preterm babies is necrotizing enterocolitis and intraventricular hemorrhage. A change is needed. So now that we have discussed some problems and the need for change regarding delayed umbilical cord clamping, let's discuss a solution to the problem. All problems require a solution to help solve them. My solution to the problem mentioned is a policy mandating all capable hospitals to practice delayed umbilical cord clamping and to have a policy in place for it, along with employee and patient education about it, along with a policy that mandates all obstetricians to discuss it with their patients. According to the American College of Obstetrics and Gynecology, only half of the United States hospitals report delayed cord clamping for most term newborns. If only half of the United States hospitals are doing it, a policy mandating it could help all capable hospitals to get on board with it, just as they have breastfeeding and the promotion of it. So now that we've discussed the solution to the problem, let's discuss the benefits of my solution and the benefits of delayed cord clamping. Policies mandate a call to action. My policy would bring about change and cause all capable hospitals to practice delayed umbilical cord clamping. Delayed umbilical cord clamping plays a big part in helping to decrease anemia, necrotizing enterocolitis, and intraventricular hemorrhage. If you recall, these are the three problems I mentioned in main point 1. According to an article published by Multidisciplinary Digital Publishing Institute entitled A Feasibility of a Novel Delayed Cord Clamping Cart, delayed umbilical cord clamping for 1 minute or longer following a neonate's birth has now been recommended for both preterm and term newborns by multiple professional organizations. Delayed cord clamping has been shown to decrease rates of iron deficiency anemia, intraventricular hemorrhage, and necrotizing enterocolitis, and also blood transfusions. Your baby deserves a great start at delivery, especially preterm babies. Now, in my PowerPoint, I discuss the benefits of delayed umbilical cord clamping again. As far as term infants are concerned, it decreases the rate of iron deficiency anemia in your term infants. In your preterm infants, it decreases the rate of necrotizing enterocolitis, and it also decreases the rate of intraventricular hemorrhage. Also, in my PowerPoint, I discuss with you the harmful effects of immediate umbilical cord clamping. That is, the harmful effects of not practicing delayed cord clamping. Some harmful effects as far as hematology is concerned, and this is what happens if the hospital doesn't practice delayed umbilical cord clamping. As far as hematology is concerned, it could decrease your baby's red blood cells, it could decrease your baby's hematocrit, it could decrease your baby's hemoglobin. It could increase hypovolemia and cause dehydration in your baby. As far as body iron stores are concerned, it decreases ferritin out to 48 months in your baby. It could decrease total body iron at 6 months. As far as cardiovascular is concerned, it could decrease adaptation. It decreases your baby's blood pressure. It could decrease red blood cell flow to your baby's brain by 18%. And it could also decrease red blood cell flow to your baby's gut by 15%. And this is what could cause that the enterocolitis that we talked about. And as far as your baby's kidneys are concerned, it could decrease renal blood flow. It could decrease your baby's urine output. And it can also increase sodium excretion. Your baby deserves a great start at delivery, especially your premature babies. So now that we've discussed the benefits of my proposed solution, let's review what we've discussed today. Today we discussed problems and the need for change regarding delayed umbilical clamping. We discussed the solution to the problem, and we all regarding delayed cord clamping, and we also discussed the benefits of my policy and delayed cord clamping. So I hope today that I have persuaded you all the great need for all capable hospitals to engage in delayed umbilical cord clamping and the benefits of it. Please discuss delayed cord clamping with your obstetrician prior to delivery and include it in your birth plan if so desired. Thank you.